Excellent.
All right. So welcome to Oncology Data Advisor. Today we're here at the ASCO annual meeting in Chicago, and I'm joined by Dr. Tom Abrams, who is our editor-in-chief.
I'm so happy to be here. It's been a great meeting, and just happy to get in front of the camera here and do a little podcast.
Yes, definitely. How are you enjoying your time at ASCO so far?
It's been great. It's a whirlwind of a meeting, but you get to reconnect with a lot of people you don't get to see, live in different parts of the country, and you get to the energy here is unlike anywhere else. So it's exciting for oncologists for sure.
It's also an exciting time at Oncology Data Advisor. We have a lot of new initiatives going on, including our new Fellows Forum, which is our resource for hematology oncology fellows. How do these resources help our audience, and why should readers utilize them?
Well, look, the fellows are the next generation. Without, the next generation of oncologists, we're not going to continue on. So it's vital that the fellows feel supported. They feel that they have resources to learn from. Of course, they're going to be able to pick the brains of their mentors and the folks they see patients with, but an online resource dedicated to fellows, it's absolutely vital, and I think what you're doing is fantastic.
So one of our goals at Oncology Data Advisor is to make our content as relevant as possible for our audience and to cover a broad range of subject matter. What is your perspective on covering both the triumphs and the challenges in oncology?
Yeah, so I think it's a great question. I think Oncology Data Advisors does a wonderful job at interviewing the thought leaders who are doing the trials, who are pushing the field forward, and that is vital. And one of the things that I think we can do and do better is really talk more clinically, just sort of, how certain people who are experts in the field treat the diseases they treat, talk about specific clinical questions that are conundrums and may not have specific data to sort of guide the way we treat. And so having an expert to sort of just guide you through those decisions, I think that's great. And that's, I know, one of the thrusts of 2023, and I think it's an excellent one. So I do think there's a lot that Oncology Data Advisor can do, and I'm proud to be a part of it.
Yes, definitely. We're glad to have you as a part of it. What are some of the directions or ideas you have for this coming year that you're looking forward to taking?
Yeah, so I think, really having panel discussions about specific clinical questions. I think really developing the Fellows Forum to the point where it becomes a real exciting resource for the fellows. And I think, really sort of partnering with patients and patient advocacy groups to sort of get their perspective, because I think one of the things that is missing is the patient voices. And so if we could have those, I think we'd really sort of hit all three categories of, data, clinical decision making, and the patient perspective. Yes. And once you have all three, you're really a one-stop shop for oncology, and that's really what I envision ODA to really be as we move forward and get more viewers, more participants, and I think it could be really something special, and it already is, but I think it could be something really extraordinary as time goes on.
Absolutely. So a lot of the coverage, as you mentioned here, the theme of ASCO this year is partnering with patients.
Yes.
Are there any specific ways you have in mind where we could partner with patients to achieve this goal?
Well, I think patients are really oftentimes uniquely excited to speak about their experiences, both the negative and the positive. And getting their perspectives is vital, especially for young oncologists who are just starting out, who may not have a lot of experience doing it on their own. They've seen the models of their mentors, and I'm sure get a lot of sense from that. But seeing it from the patient's perspective, they may really kind of say, hey, maybe I could do it a little differently. Maybe I could be a little bit, different in the way I deliver information, the way I explain things, so that patients feel supported. Oftentimes, we're tasked with a very difficult job, telling patients they have an incurable cancer, that we're going to fight like heck to make them better, but ultimately they are going to succumb to their illness. And that's a difficult message. And so knowing how the patient accepts that, how the patient receives that information, and how you can move forward from that, I think is of vital import.
100%. Well, this is great. We have a lot of really great ideas for how we can address all of these this coming year, and I'm excited to see how they all play out.
I think, it would be remiss of me to not mention your efforts, Kira, and the efforts of the folks who work on ODA. This is really a group effort, and it's been my privilege to be a part of it.
Yes.
So thank you.
Thank you. Yes, we have a really fantastic editorial board right now.
Yeah.
A lot of different perspectives we have, so it's really great to incorporate all of these into our ultimate goal of improving care for patients.
Absolutely.
Great. Well, thanks so much for stopping by today and talking
It's my
about this.
pleasure.